If you're paying $50 for a specialist visit and your neighbor's only paying 10, you may be on a Medicare plan that's quietly draining your money. And most people don't realize it until the damage is already done. I'm Suzanne Fasella, and I'm founder of Caregiver Haven in the Haven community, where our members and clients work with me for their special challenges that they have, both as seniors and as families members giving care to their seniors. And for 25 years, I've helped seniors and their families navigate aging as a physician assistant in not only geriatric care, but also emergency medicine and urgent care. So if this helps you, please subscribe, give it a thumbs up, and share this video with someone who needs it. That's how I keep making content for you, content like this for you. And it also helps with YouTube sharing it with many more seniors and family members. Now, if you've ever opened a medical bill and you thought this feels way higher than it should be, you have to trust that feeling. In all the years that I have practiced, I've never seen an accurate medical bill. I've always been able to get them down. So you're not just imagining this, it's very real. Medicare plans can look similar on the surface, but the costs underneath are going to be completely different. Some plans feel cheap up front, and then they hit you harder later with the copays, the deductibles, and the medication costs, okay? And then other plans cover your doctors, and until January 1st hits, and then suddenly your network changes, and now you're paying out of pocket for those out-of-network doctors that have been doctors you've been using for years, and you're scrambling to find someone new. These plans change all the time, all right? What you sign up for in October may not be the same thing you get in January. I don't know why they do it this way, but they do. And if you're a caregiver, a family member that's taking care of a senior, this can be exhausting, especially because you're not just protecting your money, you're protecting stability here, okay? Surprise costs are going to create stress, delays in care, and sometimes people skip appointments because they're afraid of what the bill is going to be. How many times have people said, I'm not going because I don't have the money to pay for it, right? So here are the biggest Medicare traps I see again and again. First, skipping drug coverage at the start. Many people can't wait to sign up for Medicare, but they do not realize that they have to sign up for a Medicare Plan D, okay? It's Part D. D is for drugs. They have to sign up for the Part D plan. And they say to me, but Suzanne, I'm not on any medications. You still have to sign up for it, even if you don't take any medications. Penalties are going to follow you. I've seen senior after senior who never signed up for the Part D plan. I think this is a gross injustice on seniors. But now one lady's paying $90 a month for the rest of her life. It's a penalty fee, $90 a month. Another one's paying $43 a month for the rest of her life on Medicare because she didn't sign up for Part D. There's a penalty incurred if you do not sign up for it when you sign up for Medicare. So you must sign up for Medicare. I can get your drugs down to practically nothing, but I cannot get rid of that penalty fee. You will always pay it if you don't sign up. Number two, choosing a plan based on the monthly premium only. I see this over and over again. Medicare healthcare brokers love to push Advantage plans because yes, they are cheaper, but they also get a significantly huge commission on the Advantage plans over the Medicare original plan, okay, which is more expensive, but it covers a lot more. So the reason I'm telling you this is you've got to choose a plan that's going to fit your needs. A $0 premium sounds amazing. I'm not paying for health care. I'm on Medicare. Yay. Until your co-pays, your co-insurance starts piling up. And then all of a sudden, I'm going to get free glasses with my Medicare Advantage plan. You go to the doctor, they say, we don't have those glasses. Those glasses are from 1980. Nobody wears those anymore. Here are your new glasses and your eye exam and your cataracts you're going to need. And that's going to be a $10,000 bill. Or you go to your they say free, what else do they say? Free hearing aids. Oh, I'm going to get free hearing aids, right? And then you go to get your hearing aids, and the doctor laughs at you. The audiologist laughs at you, says, "Yeah, I can give you hearing aids, but those are from the 1960s, and though we don't recommend them. They're not going to do you any good anyway." And so you end up paying $12,000 for hearing aids because Medicare doesn't cover them. You've got to read the fine print. So choosing a plan on monthly premium only does not cut it. You've got to know what's involved in it. And you've got to ask these doctors, and you've got to go to the office and talk to somebody about this, or call. The receptionist sees this every day. He or she knows exactly what the problem's going to be. And when you talk to them, they say, "Oh my gosh, no, Medicare doesn't cover it. They cover the worst things in the world." Remember, Medicare is socialized medicine. It is government medicine. It's not in your best interest to go with the cheapest plan. Okay, they're not going to give you the 5-star things that you need. All right. Third is not checking your hospitals and your doctors. You may love your doctor, and you're still going to end up out of network if your plan changes. I've had this happen over and over again, especially with where plans don't pay anymore. If plans don't pay anymore, the doctor's going to drop it. The whole hospital system will drop it. This is very true of Mayo Clinic. Mayo Clinic doesn't take Advantage plan anymore. I don't know that Johns Hopkins does anymore. I don't know that Cleveland Clinic does anymore. The reason being is they can't afford to be not paid, and Medicare Advantage plans will not pay them. So your insurance is not accepted at many of the premium top Medicare centers in the world. Now, they may have what they call our membership services for you, where you can join a membership and then you can get a lower cost, but they don't accept your Advantage plans. So you need to know what hospitals and doctors you love that are in your plan. Fourth, you're not pricing out your Medicare, choosing a plan. Many people do this, but they don't do the other things that I've mentioned. Okay. But you have got to check out your medications, what you're on, what you're likely to be on later down the road. And you've got to know what your generics are. And the best thing to do here is just pick up the phone, call your insurance company, say, "I need a copy of my formulary," which is the first tier, second tier, third tier of your medications. It may even be a fourth tier, who knows? But you take this form to your doctor. All right. It's good for a year. It's good for a year. Doesn't mean the price isn't going to change on it, but it's good for a year. And you say, I want you to only pick from the generics from the first tier. Okay, when you're giving me a medication, because your doctor doesn't know what your insurance is. Your doctor may give you a combo medication, a combination medication. It's got 2 different medications in it. Well, that may be 10 times more expensive than you getting 2 single medications and taking 2 generic medications, right? So the same medication can cost you $5 on one plan and $80 on another plan, depending on the tier and the formula. So you got to know that. Fifth, you're not reviewing your plan every year. And what you do is your health changes and you don't realize that. And you might need something more this year that you didn't need last year. And so stop fooling yourself here. If you're going down, if your health is not what it used to be, don't just set it aside and say, "Well, let's forget it," and you automatically get re-enrolled in the same plan. You can't do that. These mistakes don't always show up as a disaster, as one big disaster. They're the little things that leak $40 here and $75 here and this here and this here. Do a 15-minute cost snapshot. Grab a sheet of paper and write down these 5 things. Number 1, write down your premium. Your monthly premium is 0, great for you. But now let's look at the other things. Number 2, your primary care copay. You're going to go to your primary care first, all right? See what that is. Number 3, your specialist copay. See what your specialist copay. All right. If you have an accident throughout the year, you better be running to urgent care. If you're running to urgent care, you have to know what your urgent care copay is, because you're going to have one. All right. Or you can't get in to see your doctor. It's not an emergency, but you can't get in to see your doctor. So they say, we'll go to the urgent care. Well, you go to the urgent care, it's going to cost you more. That's not good medicine. Right. And then number 4 is your out of pocket maximum. How much do you have to be pay out in order to finally not pay anymore? Are you going to hit that in June, or are you going to hit it December 28th when it really doesn't do you any good? All right. And then number 5 is every medication you take, you have to know what you're paying for it right now. You have to know, because we've got to get those prices down. When all the numbers are in one place, your patterns are going to start jumping out, and you're going to see what's really draining your money and what you need to change. And when you stop walking around with that constant, I hope we pick the right plan feeling, it's why I'm giving you this PDF, this bonus. You can get it in the description. Just click there. It's free. It's going to capture everything for you that I just talked about. You can spot the money leaks first, and you're not going to miss a lot of it. All right. A lot of people don't realize, too, that there is free counseling resources out there in many areas. Licensed Medicare advisors are out there who are going to walk you through all your options. And these people have been doing it for years. They're real professionals. They live in their offices during the Medicare enrollment time, and they're helping you choose the best plan without any confusion. They will be there for you year after year after year. I am not talking about the person that sits in front of a grocery store at the table and says, sign up for Medicare here. No. I am talking about a real professional. They're called healthcare brokers. Ask your neighbor, ask your friends. All of us know how to find a healthcare broker. And they don't advertise, but they're out there and they're free. They're free because insurance pays them to get you the right plan. Insurance wants to make sure you get the right plan. So insurance gives them a commission off what you do. I'll give you a perfect example is AARP. They get a commission off every United Health Care plan they sell. Okay. And it equates, I think they get maybe I'm not sure. They get X number of dollars a month off every plan that AARP sells. And since they have so many people and they reach so many people, United Healthcare pays them about $3.9 billion a year in commissions. It's very lucrative business. So these healthcare brokers know exactly what they're talking about. So you go ahead and get yourself a healthcare broker. They're free. All right. And don't take advantage of healthcare brokers either. Use one that you like. Interview several, use one that you like, and tell them everything about you. Everything about you. Don't hold anything back, because your plan may not be the best one for you if you hold back one tiny thing. If you say you don't smoke and you do, you could end up on the wrong plan. So you've got to tell them the truth about everything, all your bad habits. Yeah, this is confession time. Okay? So also, if you're taking care of somebody, you may not know this insurance language. So what we're going to do is go to that broker. They know exactly. But in the meantime, do the 15-minute cost snapshot. The premium, the copays, the out-of-pocket, what's it going to cost for a specialist, all of this stuff. Grab it so you'll have it and you can keep track of it and pull those medication costs in there too. So if this helps you, subscribe to the channel, share it with someone who needs it, and give it a thumbs up so I can keep making these for you. And YouTube will spread the news. Take care. We'll talk soon. Bye-bye.